Hello, everyone. This is Braswell Dean from the Providence Hospital Department of Family Medicine. Today, we are going back to our coding game for review, and today we are reviewing the data part of the complexity of medical decision making. So last time we again mentioned that risk, data, and diagnostic management decisions all help determine the complexity of medical decision making. And this complexity of medical decision making really is what we are emphasizing you to think about, to let that drive the code that you select. So today, let's talk about data as it pertains to generating our complexity of medical decision making. So we'll jump right in, just as we've done before, and look at data for 10. You see a patient and order some labs. How do you calculate the data points? And as we said last time, if you have your worksheet in front of you, now is a great time to look at it. Let's take a look at this worksheet. The data section on your worksheet is listed by lab tests, x-rays, diagnostic tests, discussing results with other doctors, looking at old records, either reviewing them or ordering them, or looking at tracings or specimens. So the question we said, looking back at data for 10, you see a patient and order some labs. How do you calculate the data points? So lab tests are here. And the reality is that no matter how many lab tests you order, you just get 1 point for ordering the lab tests. And I've seen so many folks ask questions about this. And the answer is whether you order a CBC, you get 1 point. Whether you order a CBC plus a BMP or a CMP, even though there's a whole bunch of labs in that, you still just get 1 point. A CBC, a BMP, a TSH, a free T4, a lipid profile, A1Cs, whatever you're going to order, all kind of testing, hepatitis screens, you still just get 1 point. And, you know, I've had people ask me questions, well, you know, like for an SMA 18, you know, I ought to get 18 points. And the answer is no. To the world of the doctor, maybe, but to the world of the coders, no. You just get 1 point for the lab tests that you order. So this one, for data 10, if you see a patient and you order some labs, how do you calculate the data points? Again, this one's pretty easy. You get a point for ordering labs. Okay? No matter how many you order. Let's look at data for 20. You've just seen a patient and you've ordered labs and you've ordered an x-ray and you've reviewed the patient's old records and you've documented any relevant findings. How many points do you get? So it looks like you've done a little bit more here. Ordered labs, ordered an x-ray, and reviewed the patient's old records and documented stuff. Okay, so in this section, you get a point, like we said before, for ordering labs, and we're going to get a point for ordering the x-ray and reviewing the old records. Now let's take a look at your data sheet. You get a point for ordering the labs. You get a point for ordering the x-ray. And you're getting 2 points for reviewing the old records. Okay. Let's talk a little bit about that. First off, we said you get a point for ordering the lab tests, and we all kind of know that because we learned that from the last section, the last example case. But x-rays sometimes generate a few questions, so let's clear them up. If you order an x-ray, you get a point. If you look at the x-ray yourself and review the specimen, you get 2 points. And you can give yourself 2 points if you're looking at the EKG and interpreting the EKG in your note. You can give yourself 2 points. If you're just ordering the EKG and relying on someone else to read it for you, you get 1 point for the EKG. But anytime you directly review something, whether it's a KOH slide with a wet prep or a chest x-ray or an EKG, you get 2 points. So a lot of times when you're in the hospital and you're looking at these EKGs or chest x-rays, again, you can get 2 points. But in our case, we just ordered lab tests, we get a point. We order an x-ray, and we give ourselves a point. And I think it's always ethical. You know, there may be some people out there, even right now, wanting to ask a sub-question on this. Well, you know, I really reviewed the x-ray, and, you know, even though somebody else is reading it, but, you know, I read it for myself, I want to give myself 2 points. Or the same thing with EKGs. It depends on how your institution is set up as to, is the ultimate read by someone else or not. We've had these discussions several times when we were going through this course. I think we always defer back to teaching you the most ethical way. So in general, I get it that you could read the x-ray yourself or the EKG yourself and give yourself 2 points. But if there's anybody in the institution who's there to oversee it, I think ethically, you could just give yourself a point because you ordered it. And it's not that big a deal. If it means, if you're one of these doctors that you're out there in the country and you've got your own x-ray machine and you order the x-ray and that x-ray is in your office and you're reading it and basing decisions, you get 2 points. Same thing with the EKG. So I would just always defer to some of these scenarios that you might be in your individual practice to the most ethical interpretation of these rules. And that's generally what the coders are all about as well. So we talked about we get a point for ordering lab tests and a point for ordering the x-ray. But now, in this example, we're getting 2 points because we reviewed old records. Okay. What does that mean? And this was put there strategically. Why? Because there's so many questions that always pop up year after year about what are old records and what is the intent of this rule. So when we're talking about reviewing old records, this is meant, and this is coming from the coders that I've been working with as we develop this course, the intent of this rule means significant amount of old records that comes to you when somebody's transferring care and there are a lot of records to look at. So Grandma Jones is transferring into your practice and she's coming up here from another state and Granny comes in and says, you know, nice to meet you, here are my old records. And you go, wow, thanks, Granny. And you look at them. And if you take the time in your office visit to look at Granny's old records right then and there, you get yourself 2 points. Okay. But if you say, you know what, Granny, thanks for all these old records, I really don't have time to look at all your stuff right now. I'll look at it later tonight. Because later tonight, I'm going to stay here late just to look at all these old records. And you're there and you check them all out later that night. And you're finishing up your note maybe later that night. Can you give yourself 2 points because you looked at them? And the answer is no. Because this implies the services that you render when the patient's in the office. Again, all of these rules apply as a slice in time when you see the patient, when you render the service. So if you save the old records for another day when you've got time, this is not, you don't get 2 points for doing it. And you don't get 2 points for reviewing the old records like 2 or 3 days before Granny shows up in the office for her appointment. Oh, hey, nice to meet you, Granny. I've already gone through your old records, and I'm going to give myself 2 points today. Nope, you can't do that either. you've got to look at Granny's old records when she's here in the office in front of you. You get 2 points. And practically speaking, you know, a lot of doctors may not have the time to look at all Granny's old records right then and there. So if you don't have that kind of time, you don't get to use 2 points for looking at Granny's old records. So I hope that clears that up, because that always is a question. Now, another question that has to do with review of old records is, what are old records? Because a lot of times people say, well, you know what? You know, I looked at the EMR and Granny was in the hospital last week, and I looked at the EMR and the emergency room doctor's note, and, you know, that's old. It's older than the visit today, technically. That's an old record. So if I look at some old records, or maybe some previous hospitalizations, or, you know, maybe I'm reading the note from the consultant that saw the patient when they were in the hospital, or I'm reading the note from the consultant that saw the patient in the office maybe a week or two ago, or a month ago, or maybe even last year. Those are technically old records, aren't they? Don't I get 2 points for just, you know, looking at those? A lot of people say, well, don't I get 2 points for just looking in the EMR, you know, at the previous notes? And the answer, again, is no. Because even though those notes from the emergency room, or from the consultant, or from another doctor are, quote, old, you know, they're older than the visit today, that does not constitute what this means. It does not constitute, you know, this big transfer of files from one office to another, the substantive amount of records that are coming in that you have to review, the comprehensive review of the medical condition. So just looking in the EMR is not, you don't get 2 points basically for looking every time you look in the EMR. That's the bottom line. So you don't get it. So again, that's part of the service that you're rendering, but if you do, you get 2 points during the visit. Now, another issue that will come up is, let's say you say, you know what, nice to meet you, Granny. I want you to sign a release of records form while you're in the office today, and we'll send that out to your old doctor in the other state that you're transferring from, and we'll try to get your old records. Or little Jimmy's back in the office, and we don't have his immunization records from his previous pediatrician or something like that, and you say, you know what, I want you to sign a release of records so that I can, you know, see his immunization records. Or somebody else was in the emergency room at some other hospital, and you don't have those records available, and you say, okay, you know what, let's sign the release of records to get those hospital records, or ER records, or admission records. Then that's worth a point. So if you put in your note, we'll have patient sign release of records, yeah, you can give yourself a point for that. So that's the difference in the old records. Sign a release of records, you get a point when you make that decision, or if you actually review the old records. Okay? So we order some labs, we order an x-ray, and review the patient's old records and document relevant findings. How many points do we get? Again, we get 1 point for ordering the labs, 1 point because we ordered the x-ray, and 2 points because we review the old records. And again, another learning tip is that if we're reviewing the x-rays of the EKGs ourselves, making that read, again, this could change to 2 points. Let's look at data for 30. If you see a patient and you don't review anything, and you don't order anything, you don't order any labs or x-rays or diagnostic tests, and you don't look at any old records, because sometimes you don't need to do all that stuff, how many points do you get when you don't do all that stuff? You get 0. I put this in here just to make the point that you don't have to do anything to get the points. because sometimes you don't need to order any labs or order an x-ray or review old records. You just don't need to do that. So you don't have to worry about it. And again, the other point on this is it makes the point that there are 3 sections that we're working at. And we saw how easy risk was. And we're seeing how easy the data section is. So far, it's pretty easy. And you don't even need to do this sometimes because you've got 2 other sections. And again, this complexity of medical decision-making is so ethical because the decision-making, the code for the visit, the services that you're rendering is not based on just one part. It's based on 3 parts. And you want the 2 highest levels of these 3 parts. So there's balance. There's check and balance on your complexity of medical decision making, and therefore there's check and balance on your coding. Therefore there's ethical check and balance on things. So I put this in here on purpose to show you that you don't have to worry that you've got other sections to rely on, even if you don't feel the need to do anything today. Okay? Data for 30, 0. Data for 40. If you see a patient and you document your decision to get their old records, how many points do you get? And we've kind of answered that question. We get 1 point just for documenting your decision to get those old records. And I'll show you again where that is on your worksheet. 1 point in the data section to get the old records. Okay? You see a patient, you document your decision to get old records, how many points do you get? You get 1 point just for documenting your decision. Okay, let's do data for 50. You've seen a patient and you order a CBC, an AST, and an ALT. How many points do you get in the data section? You probably already know that. You just get 1 point. All the labs you order is just 1 point. And I said this almost rhetorically just to make sure everybody gets it. The data section is such an easy section for you to learn as well. Again, lab tests that you order, x-rays that you may order, any kind of diagnostic test that you may order, all 1 point. If you discuss results with another doctor, yes, you can get a point. That is a phone call. If you make a phone call with another doctor and discuss something, you can get yourself a point. But remember, you have to document it. And remember, that discussion has to be with the other doctor at the time the patient's in the room. You could step out of the room and have the discussion, but this is not having the discussion with the doctor before the patient's in the office. Making the decision for the patient to get old records, have them sign a medical release form. That's easy. If you do look at all those records when they're in the office, you get 2 points. And if you directly review a specimen that you are ordering, making the read interpretation yourself, you get yourself 2 points. So data section's real easy. The risk section has been real easy too. So now in the next section, we're going to hop over to the diagnostic management decisions and have some fun learning those rules. And once we learn those rules, then what we're going to do is put all of these 3 sections together in real time, and we're going to go over a whole bunch of clinical cases and have fun with it. Before we do that, we're going to stop here, and now next part, we are going to look at the diagnostic management sections. So thanks a lot. I hope this was helpful, and we'll see you on the next part.